You should be careful. That exercise can jack up your shoulder. Oh, I don't want that to happen. Yeah, it causes shoulder impingement and it can cause rotator cuff tears. So you better stop doing it. Welcome everybody. I'm Dr. Sam Spinelli with Assistant Athletics.
And I'm Dr. Ryan Van Nieuwenhuis, also known as the Barbell Doc. And today we're talking about the upright row.
The upright row is an interesting exercise, and in some circles it's utilized to build the upper back and the shoulders.
Whereas in other circles, it's guaranteed as a shoulder wrecker.
Today we're going to break down the movement and analyze why some people think it's a risk. We're also going to look at what the research says on it and give some other movements that you can sub in case you can't do it. Now if you're looking for content on mobility, strength, or just moving better in general, make sure you subscribe to our channel below. Turn on the notification settings so that you don't miss any tips. For those looking for a program to help them with mobility, strength, and moving better in general, make sure you check out the description box below where I'll link all the programs that we have. As well, be sure to check out Ryan's content on Instagram at @TheBarbellDoc.
So what is the upright row? The upright row is an exercise that we generally do with either dumbbells or barbells. We start with our arms extended out in front of us, bend our elbows and row upwards, keeping the implement close to our bodies. Now, some people stop when the arms are horizontal to the floor, whereas others stop when the implement comes up towards their chin.
Why do people perform it? Usually people are doing upright rows to strengthen their upper back, their delts, and their traps. As well, for weightlifters and CrossFitters, it's similar to movements that they do competitively, so it may be utilized as a supplemental movement to build strength for their sport. Why do people think it's dangerous? Most of the time, people will argue about it being a risky movement because it causes impingement, and that can lead to rotator cuff tears. The problem is that is inaccurate, and it demonizes this exercise unfairly.
Usually, the impingement argument centers around the fact that some people claim that the upright row mimics a shoulder impingement test called the Hawkins-Kennedy. However, this test is performed with the shoulder in 90 degrees of flexion and in horizontal adduction. In contrast, the upright row is performed with the shoulder in an abducted position, which is fairly different from a joint congruency standpoint.
As well, we can look to a paper from Brossman et al. Where they looked to examine shoulder movement under X-ray imaging and MRI imaging, where they were looking at what level of impingement occurred at different degrees of range of motion. They found that the supraspinatus began to impinge as early as 30 degrees of abduction and shoulder flexion. We don't generally see people reporting symptoms like shoulder impingement at as low as 30 degrees, and so this kind of tells us that this is not so clear cut. Further, for anyone that's thinking that was just the start of impingement and as you go higher that there's an increase in impingement, well, that's true, except for that they saw peak impingement occurred at 60 degrees of abduction and 60 degrees of flexion. So once they got past that, it actually decreased.
When we consider that and lay over other factors such as exercise is just as effective for shoulder impingement as surgery is, and the fact that there are many people out there who have some level of rotator cuff tears without having any symptoms, things start to look a lot less clear for this topic. Now, there are going to be some people who have symptoms with the upright row, but that's with any exercise out there. For those people, we can first try a few modifications.
Firstly, try swapping between either a barbell or dumbbells. Each has an advantage that some people might benefit from. The barbell is more stable, whereas the dumbbells allow for more variability in movement.
Secondly, try changing your grip width. If you're using a barbell, bring your hands wider or closer together and see which feels better for your shoulder. If you're using dumbbells, try bring your hands farther apart or closer together and see which one feels best for you. There's no real one right way to do this exercise. You just have to find out what works best for you.
Thirdly, body angle. As we progressively bend more forwards, this movement becomes more similar to a face pull. For some people, a slight lean forward can change a lot. Now, if you try to modify it and it just doesn't feel good, ditch it. The upright row isn't a magical exercise that everyone needs to do. There are a lot of other exercises that we can sub in for that have just as many benefits or more. For instance, if you're looking to work your delts, doing some kind of lateral raise can be a great alternative, whether it be the regular lateral raise or a side hanging lateral raise or some other variation. In contrast, if you're looking to strengthen your traps, then you can simply sub it in for a dumbbell or barbell shrug, or you can do some form of an incline shrug or upward shrug.
Hopefully you can understand from this video that the upright row is not an inherently dangerous exercise. There are lots of people who will be fine doing this exercise and others who it simply won't feel good for.
If the movement doesn't align with your training goals, don't feel the necessity to do it. But if it does align with your training goals and it feels fine to do it, get after it. Thanks for watching and we'll see you in the next video.